You're listening to PTAF Podcast, sharing our love of fitness and how we fix pain for many athletes with physical therapy that matches their intensity, so they keep training and stop missing workouts.
Hello, this is Dr. Mandy Vonderhaar, and I'm here with my co-host, Dr. Maddie Betts. Hi, Maddie.
Hi, Mandy.
We're here for, episode 2. We're back. We made it through 1, and they liked us so much, they asked us back.
Or we invited ourselves.
We invited ourselves back, yeah. So last week we talked about how to fix back pain with your deadlift. So hopefully that was helpful to everyone. And this week we are talking about how to return safely to the rig after quarantine, which I think we'll talk about pull-ups and toes to bar, muscle-ups, anything you would do on the bar specifically, but I think this is probably true for a lot of movements that people haven't been able to do since they've been at home.
Yeah, I think we're all really excited to get back in the gym and hang on those rigs and do toes to bars and pull-ups. And we should also probably give tips for how to treat like tears in our hands at the end of this too. But
oh yes, that'd be good too.
Yeah.
So just a couple announcements before we get started. Just wanted to remind you guys that Maddie is taking in-person appointments at the gym every day now, except Saturday and Sunday. And then we're both still doing virtual visits as well. So if you're not comfortable coming into the gym just yet, we can still meet with you virtually if you have something going on. Okay, so let's jump right in. So Maddie, what would be one thing you would look for, maybe ask yourself or ask someone if they're thinking about hopping up to that pull-up bar?
I would think about maybe the last time I was on a pull-up bar. And for me personally, I do not have a pull-up bar at home. So I would basically just like, if I was out jogging in a park and I'd see a pull-up bar, I'm like, sweet, I'll just stop and do some pull-ups. And I was kind of the nerdy PT that I am. And I was like, I better not do kipping pull-ups because my shoulders, I just don't think are ready for that. My elbows aren't ready for that. So definitely taking a glance back at the last 8 weeks of your life and saying, when was the last time I hung my entire body weight from my hands?
Yeah, so I think looking at what we've done over the course of this quarantine is important. I think it also needs to be noted, like now is not the time to hit the gym and be like, now I'm going to attempt my first set of 10 pull-ups. I think looking at what were your abilities before quarantine, before going into quarantine, how capable were you of doing pull-ups in the WOD? Did you use a band for assistance? Did you do kipping? Or were you modifying those things before? So looking at that as well.
Yeah, I think this is also a great time to, if you have anything to fix, you start with a clean slate. So you can also know like, hey, I wasn't super happy with my pull-ups. I didn't feel like they were making me stronger. I might have just been flailing around on the bar. And this is a time that you can really just kind of lay out a plan when you come back, because I think everybody's going to be not ground zero, but we can all have new starting points, and it's all a great time to have a new starting point.
Definitely. So we're going to talk a little bit later about how to figure out a little more quantitatively how much volume you have been doing compared to maybe what your gym's programming looks like or what you're personally wanting to do, and how to do that safely. So we'll talk a little bit more about that later. The next things we're going to talk about, I think, apply to everyone for any type of injury, but we're going to talk specifically about pull-ups. And what we're going to talk about is the mobility requirements for a pull-up, the strength requirements for a pull-up, and the endurance requirements for a pull-up. And so just some of the kind of baseline things we want to see as PTs, and we recommend for our patients before they're going to go do a big set. So let's start with mobility. Maddie, what kind of mobility requirements do you like your patients to have before they're going to try to do just even some strict pull-ups? We'll start there.
Yeah, we can start with a big one here. Obviously, lat length. anything where arms have to go overhead require you to have the mobility in your lats to get your arms at least by your ears. And in the case of a kipping pull-up, they have to be able to go behind your ears. And of course, that range of motion comes from a couple other places, but we're asking it to do a lot there. And so a couple of ways that we like to check lat mobility is in just a simple test of laying on your back, either with a dowel rod in your hand and your knees are kind of pulled up into your chest. And you're going to take that dowel rod, about the same grip you would have for a pull-up, and let it fall back behind your head. That dowel rod needs to fall pretty easily to the ground, or if you did it in seated, you should be able to sit against a wall and pull that bar all the way back to the wall. Great, so those are two ways that you can test yourself really easily. And then even simpler than that is sometimes the fix is actually the test. So laying on your back, maybe getting on a bench where you can get a little bit of a deficit, taking the dowel overhead and just hanging out there, making sure your little back stays flat on the back or on the bench that you are on or on the floor. So you're getting that really good stretch in your lats, making sure your ribs are pulled down and your core is tight. So it's just isolated into that shoulder joint perfectly. That's just a solid place to start that can improve any pull-up.
Yeah, that's a great point about not just being in line with your head, but when we talk about kipping, having to go behind that. And so that's an even greater demand on that lat for flexibility. The other thing I like to look at is just shoulder external rotation. And I think that ties in with how your lat mobility ends up looking, because if your shoulder can't fully externally rotate, you really can't get to that overhead position. So they certainly go hand in hand. So I like to look at, hey, if you're just standing there against a wall, can you open up your arms and touch your thumbs close to the wall, if not touching it, with your arms just in front of you? And then could you open up your arms in front of you at 90-90 and touch the wall behind you there? And if you can't do those things and you're lacking some of that external rotation, you're probably not going to be able to go all the way overhead and clear some of those structures in our shoulder that we don't want to impinge upon. So clearing up that lat flexibility along with external rotation before you're hanging from the bar is super, super important. So if you can't do those things, like Maddie said, working into that test for mobility and using it as a time to gain more mobility. So spending some time in those positions and working through that with some weight to make sure you can get there. Great. So the next thing we're going to talk about are some of the strength requirements that we need for a pull-up. So Maddie, why don't you tell us about, and this kind of leads to what you were talking about before, lat length, but also lat strength. What kinds of things do you look for lat strength?
So one of the things I find super interesting about pull-ups is that we have to have this massive amount of lat strength. We also have this massive amount of lat mobility, which is probably two of the hardest things to combine together. So what we're really trying to hit for your lat strength is possibly a lot of eccentric type movements where you're doing like a lat pullover and you're keeping your core lats down and you're allowing your lats to eccentrically or slowly lower that weight overhead and then contract your lats to bring it back up. So getting that combination of eccentric control with a concentric strength exercise back up are one of my favorite places to start. And then, of course, if you are looking into any kind of CrossFit coaching or standards for pull-ups, especially kipping pull-ups, they like people to have 3 to 5 strict pull-ups before you can even start your kipping process. And that really is a safety reason, and it's mostly because of the eccentric control of the lat and just the way that out of kipping you come down so fast, you have to have that control. So I like to look at a person's eccentric lat control, and there's many ways that that can be trained and assessed, as well as the concentric lat control of just even like standing and doing a basic lat pull down with a rubber band and what fires first. Can I get my lat to do what it needs to do by itself without maybe a bicep firing first, or a pec even sometimes you'll see kick in right away. And so I like to just really isolate that lat, make sure it has a good neurological connection to then go ahead and get into that eccentric and isometric as well at the top exercises to get those going.
Yeah, I think that's something we touched on last time when we talked about back pain. When people's backs are spasming under load and tension, you mentioned it being because maybe there's not enough helpers around in that area, or the right muscle is not firing to do the work. And so a lot of times if we see that front of the shoulder pain or that neck pain or that forearm elbow kind of pain with a pull up, then we know those lats are not really doing their job. Those other little helpers are kicking in a little bit too much.
Yeah, I think it is actually a very, very common thing that I see in a lot of patients that do have shoulder pain that is accentuated by any kind of pulling movement, is that sometimes the lat, even though it's so huge, can actually be kind of totally negated from the whole process. And to get them to really connect to that alone is just beyond effective.
Yeah. So I think the exercise you mentioned of laying on your back, letting that load go past your head is an important one for showing that we not only have mobility in the lats, but we have some strength and stability. I also like a nice bent over lat pull down to show that I can take that load from a full range of motion past my head and pull back there. So that full range of motion and slowly coming out of that position there.
Yes, and that is so great for kipping pull-ups too, to start to work on that control. I love that one.
Definitely. So I think we're actually under a tornado warning. Doug just was like, hey, your podcast might have to take a pause there because I think this is a tornado warning. So I know
they were just going off here too.
Okay.
Wait, I lost your face. There it is. Okay.
Okay. So many dang technical errors. Okay, I'm on my phone network now, so we'll see how that goes.
Okay.
But that was definitely my internet cutting out, so you do sound fine. So.
Okay.
All right, let me just pull up my outline here. Okay, well, I think we did a good job already so far being more practical based.
Okay.
So it all sounded really good.
Good.
So I think we can resume with hitting external rotation strength. So I'll start there.
Yeah.
Oh, it already is recording. That's nice. Okay.
They're going to be like, they changed clothes and.
That's what I was just saying. Okay, hello everyone. So Dr. Maddie and Dr. Mandy back. You didn't really take a break from us. We took a break from you. We had a wardrobe change of scenery. Maddie's at the gym now. But there was definitely a tornado that touched down somewhere nearby, but we're both okay. So back to business. So I think we left off talking about rotator cuff strength. We just talked about lat strength and how important that is. And now we're going to discuss why and how the rotator cuff is so important. So rotator cuff being 4 muscles of our shoulder that surround the ball and socket joint. So supraspinatus, infraspinatus, teres minor, and subscapularis. So all of them kind of center that ball in the center of that joint. And we especially need that if we've got a load over our head, all of our body weight hanging from the bar. So having some good strength there is very important. So Maddie, do you want to talk about what exercises you like for rotator cuff strength for pull-ups?
Yeah, so some of my favorite things are starting with the external rotation factor of the rotator cuff function. Because the lat is such a huge muscle and it's one of our major internal rotators, the external rotators have to be beyond strong, and they're all pretty little. So this is something that just has to be hit. And whether it's with a pull-up or anything that we do, if there's ever any extra time, spend it with shoulder external rotation. And the first thing that comes to mind for pull-ups especially is getting the arm in about like the shoulder in a 90-degree abducted position, somewhat that it would be close to in the pull-up position, and taking the hand back into external rotation just simple as having that band forward and you're just pulling back this way and really trying to keep that shoulder depressed, shoulder blades pulling in and are backing down as you do that. And that's pretty much as simple as you can get and as effective as you can get.
Yeah, EMG studies, tons of research shows that's a number one way to fire up our external rotators of our rotator cuff. And I think what's important for CrossFitters who want to have that good pull-up strength, stability, and endurance is pulling that band past their head. So not just externally rotating through that motion there, but getting it past that neutral point, because that's where our lockout position is overhead for weight, but also where the backswing of that kip happens. So having that full range of motion of external rotation, like we talked about before, being able to pull that resistance back with not the dinkiest band you can find in the gym, but you should be able to do it with at least that red monster band, maybe even a step up from that. But if you cannot do that with the orange band, you need to spend some serious time working on that. I like to work that into that overhead position then too. So externally rotating to 90-90, and once you're proficient with that at full range of motion, then can you take that overhead for some endurance there?
Yeah, and I would say commonly the things that I see that can fake external rotation and you're still getting this movement, but the front of the shoulder will start to pitch forward like this and you're still pressing. But that is a key sign that you have lost your external rotation. So what you really want to focus on is making sure the front of that shoulder stays back and down as you go to press overhead, and the bicep is shining forward. The armpit is rotating forward as you're doing that. Because if we leave this position and start to come up and forward, we've not achieved any external rotation. So that's just something to watch for if you're going to perform these exercises on your own, that you can really isolate in and keep that shoulder back and down.
Definitely. So I think a great way we like to show this to people first, if they're having difficulty with even just the orange band, is in the prone position. So laying on your stomach, having that elbow supported on the ground, but really thinking about driving that elbow into the ground. So you've got some leverage there first to actually activate those rotators and firing up that thumb away from the ground. So that does give you that feeling of, okay, I can open up my shoulder and bring some weight over my head. So starting with that on your stomach, if you can't do those banded ones, is a really good option. I think I'm always surprised with some of the seemingly strongest athletes that I work with who cannot do that with an orange band. And I call them like sneakily weak. You're not really weak overall. Those external rotators are just so much weaker than internal rotators. Those lats tend to be strong. But those external rotators are kind of lagging behind, and it's not like you have no strength there. You just have more strength in other areas, in the bicep, in the pec, in the lats compared to the rotator cuff muscles. So I think that's the one that I see some of my stronger folks need to work on the most.
100% agree. I think that's super common. And I always tell people, like, your big movers are really strong, but if we don't have that 1% backing them up that centrates the head and the shoulder joint, we are in big trouble. So if you, again, just reiterate, if you can hit anything before you leave the gym, hit external rotation.
Yes, definitely. So one of my other favorite accessory muscles to train is serratus. And that works really in conjunction with rotator cuff muscles to glue that shoulder blade to your back, and especially working that muscle once you're overhead to pull that shoulder blade down and back in the joint. The shoulder is inherently a very, very mobile, flexible joint. And a lot of times in our stronger CrossFitters, we'll see them complaining of actual tightness in that shoulder. They don't really have tightness. They just have tightness on one side of the joint that's just grabbing on there because of that imbalance that we talked about before. So getting those rotator cuff muscles turned on better, getting the scapular stabilizers like serratus turned on to pull that shoulder down and back in the joint is really important. So before we had talked about like a bent over lat pull down. I like that with a little scapular depression first and then that pull down so that we know that we're setting that shoulder blade down in the joint and then pulling down there. And I think go ahead.
That's a great point. And just to circle back to the serratus really quickly, if you are doing any kind of like on your side external rotation or serratus activity, serratus and external rotators will go hand in hand so often. And because those external rotators are so small, that I often use them as like the first cueing to like fire the serratus. And then once people can feel that, then they can get in the serratus because they've never once thought about that muscle ever.
No one thinks about their serratus.
No, but it's a big eye opener for them to be like, oh, I felt that back here, and now I feel where my shoulder blade goes and what takes my shoulder blade there. And so that's a great point on your end to like hand in hand those two things together for that.
Yeah. I think the one time people maybe could recognize what serratus does is with a push-up. So sometimes when you're going through a push-up, it's kind of that top of the push-up position. So from here, punching and controlling back there. And it's easy to conceptualize that with your hands on the ground in a push-up, but we want that overhead as well, controlling that punching motion. So bigger range of motion, bigger control needed. Okay, so in terms of that control that we need for the shoulder blade, for the rotator cuff, for the lats all together, if we put all of those things together, we can work on some active hangs on the bar, and that's the best way that we can demonstrate endurance in all of those muscles working together. So I like to have people practice just hopping up onto the bar, and then from hanging position, are you in a dead hang, just really disengaged on the bar, or have you lit everything up? And by everything, we mean lats, rotator cuff, and serratus, all of those shoulder muscles, and not just your neck and your biceps.
Correct. That motion of the reverse shrug. So a lot of people even have a hard time listening now say, can you pull your ears away from your shoulders? Like, can you feel that they're touching and be able to reverse shrug that? And for them to connect with that is huge, number one. And definitely where we start. So I think the next things we're going to talk about all kind of have like this is where you start, this is where you go next, as far as training your muscles to be able to do pull up, as well as getting your shoulders tolerating. Even if you have done pull-ups before and you haven't done them in a long time, this is all a great place to start, so that not just the strength is there, but the tendons are getting used to that load again, the bones are being able to be in the right point in the joint and stay safe.
Yeah, I think that active hang position is just such a foundational activity we look at for even a strict pull-up that's banded. So if you're having difficulty even taking off some weight with a band, or sometimes I'll like to put people seated on the ground in the rig hanging on to a bar to deload that a little bit. If you're having a hard time just getting that active hang there without an elbow bend, without your neck tensing up, without your chest rising so that you're leading with the tops of your shoulders there, you need to deload that a little further even. So completely sitting on the ground, bringing that bar a little closer to you, standing on a box, using more bands, but really seeing if you can initiate that active hang, control yourself out of it eccentrically, nice and slow, and build up some endurance with that activity.
Yeah, so then the next position of that would be maybe doing an active hang at the top of a pull-up. So the bottom being the easiest place to do that. The next part is to maybe stand on a box and get you, so if you stood up, your chin is right over the bar, and now we can feel what that feels like at the top. Can I keep my chin over the bar and keep my lats engaged without my shoulders dumping forward, without my biceps holding my hands in like this, and really start to feel what that engagement feels at the top? And that's probably like stage 2, I'd take somebody. And then exactly what you said, going down into that eccentric, making sure that we can control back down to the bottom.
Definitely. Yeah, so I think once you can prove to yourself that you could do some more endurance in both of those activities, so the bottom of that active hang, the top of that active hang, controlling through the motion of the top of that hang, and think of it like endurance, like you're going to hold a plank. Can you hold for a minute at the top, a minute at the bottom, and then go through succinct sets for a minute? of both of
Right.
those. So. Okay, so I think aside from a strict pull-up, when we get into talking about kipping pull-ups, we like to see that active hang position from the hollow body position of the kip as well as the Superman. We don't want to be dead hanging from the start of that position, dead hanging into a Superman, dead hanging into your hollow body. That is a super inefficient way to do it, and that's why you see people flailing around on the bar. But that also is a very compromised position for your shoulder. That is how you end up with pain or an injury. That's also how you end up with tears in your hand. If you are not engaged through your shoulders, then you're going to have to hold on for dear life with that bar. And that's how you'll end up with some of that ripping happening.
Exactly. I think that we take for granted a lot of times that we know that a kipping motion is from your toes through your core, through your lats, up to your arms. Like it's this transition or transmission of power all the way through that system, and you just pop right up there at the top. But for people that haven't studied body mechanics for the last 7 years of their life, that's not necessarily the first place they go, and they just see people swinging and they assume that this is a swing. But it's such a controlled movement. Exactly what you said. You got to hit that household. You have to hit the Superman position and use the transition between those, the energy is generated to be able to transmit that up through a solid core. So the lat core combination comes in again. So anything that you would, again, circling back to any of those dowel exercises we talked at the beginning, where your core has to fire and your lats at the same time. Just ultimately a huge step that if you can add that at the beginning of those kipping drills, you're going to be so far ahead in the long run.
Yeah. And I will make people prove to me that they have a good active hang in all of those positions by doing what I call like pose kipping. So can you hop up on the bar and hold that position? Then can you move into a Superman position? Then can you move into a hollow body position and be holding that, where I could like take this beautiful picture of you at each moment, and your form looks spot on. And then can you, then can you do that all together to where if you were kipping, just going through kipping, and I said stop, you would freeze at one of those positions and not be moving.
How much do your clients love that game?
Not very much.
No, it's so
Again,
hard.
it's like those really strong, seemingly really athletic looking people that can get by cheating with their kip and cheating with a pull-up for a while until they end up with pain or an injury, and we'll see that that was not very efficient for them.
Yeah. I think there's a big male and female difference too. Pull-ups obviously being just a lot harder for a female. And you can get a kipping pull-up with really not so great form really early on because it's just so hard for females to get a strict pull-up. So we can fudge a lot with some kipping, but we can also get really far with a good kip. So we have to learn how to kind of have that conversation too, I think, with our female clients as like, listen, we're just not mechanically built for this 100%, but if you do it smartly, this is how it can aid you in that. And I think you should always be building your strict capacity, but that kipping aids them a little bit into that it's done the right way.
Definitely. So I think, Maddie, we've summarized a lot of good ways that we need to check mobility before we're doing a big volume of pull-ups, strength, endurance. Let's go back now and talk about how we are going to quantify how much load we can maybe take on. And I think this will help people just kind of gauge better where they can start once they get back to the rig. So ACWR is acute on chronic workload ratio. And what that big fancy word means is basically what has your acute workload been over the past week or so compared to what your actual fitness is long term. So I think a great way to look at this is what have you been doing in quarantine for the last 8 weeks compared to what are you going to try to do in your training. And so the closer of a ratio that is 1-to-1, the safer that is for preventing an injury and staying pain-free. The bigger difference in that number, and we're probably going to see you on our table.
Yeah,
So we want to avoid that.
Yes, yes. And then I kind of took it to the next level. And so I know the gyms are going to, at least in Ohio, we're going to fly open in like 5 days. And everybody's going to come running in here and want to be so excited to be back, which is awesome. But if we kind of just take back and like look at this acute versus chronic workload and say exactly what we did, like what did I do over the last 8 weeks of quarantine versus if I come to the gym. And so I took the workout of Cindy, which has 5 pull-ups in it per round. Look at some average scores from that. So someone's going to get between 11 and 15 rounds of Cindy on average. And that is anywhere from 65 to 70 pull-ups. So let's say prior to quarantine, you've been coming in the gym and you say you hit a Metcon, your coach's program 5x5 strict one day for strength work, and then another day in the gym, you're doing 10 kipping pull-ups for 5 rounds at some point. So in that equation, you're getting 75 pull-ups per week. And then on Saturday, you come in, you're like, sweet, we're going to get Cindy, there's going to be a benchmark workout, and you do 75 pull-ups. That is a 1-to-1 ratio. Let's scale back and say the last 8 weeks, I've done some jogs, or I didn't have a pull-up at bar at home to do any pull-ups, but I saw a pull-up bar at a park, and I did 5 for 5, because that's what we do in class. So that's 25 pull-ups. Say you did that once a week. And then we get back in the gym, and one of the workouts pretty quickly coming back because everyone gets on the rig is Cindy, and you're like blown out of the water. You get 15 rounds. So that's 25 that you did up to the weeks prior, and then 75 in one day. And that ratio is obviously going to be like a third, which is really far away from 1. And you can kind of say in your head, that's a 70% risk factor that I have, that I leave this gym in worse shape than when I started. So that's just kind of a way that I think CrossFitters can see a correlation between those things. And then now we can go in and say, when you get back to the gym, these are ways that you can modify those workouts so you don't end up in that position.
I know our coaches are doing a phenomenal job now of making the programming so that we're not going to be put in this situation. I'll call it Temptation Island. But I know sometimes people are doing accessory programming on their own. Oh, and then also the programming that they're writing is for a lot of different people that are at a lot of different levels. So maybe you're at a gym where there's even just 100 people all the way up to 500 people. As good as that programming can be, there's no way they can program it specifically for you. And that is what scaling is for. That is what modifications are for. So those are your friends right
now. We talked just very briefly about the exercise you do pre getting ready for this to keep you a little bit more bulletproof. But once you get in the gym, some things that we kind of talked about to in the moment of the WOD and making modifications, obviously check with your coach. Ask all the questions. They are the experts on all of this. But from our end, some examples would be if you could do strict versus kipping pull-ups. If you haven't kipped in a long time, there's your safest bet. Even just take the reps down. If you're getting like 1 to 2 reps, obviously you're going to get a great workout. Your gains towards the strict pull-up are coming, and your shoulders are getting ready for kipping. The jumping pull-up is an awesome way to do that. It keeps your heart rate up, almost the same as kipping. You can get a lot more reps in. I have done those before, and they are no joke. And then, so those are a couple ways. And then obviously a ring row is a great way to sub if you're just not ready to get back on the bar yet.
Yeah, all good points. I think it's also monitoring the volume of even those strict movements as well, but mixing that up so that you can still get a good workout in.
Yeah.
Don't feel like you have to sit that out. Okay, so we covered a lot today. We're gonna answer some questions that people had submitted. And I think we talked about this one a fair amount, but how do I not tear my bicep again doing pull-ups? So this was from one of our old patients that we did work with who had torn his bicep doing pull-ups, unfortunately. And so, yes, how are we going to make sure he doesn't do this again?
So a lot of talk about this during his treatment sessions too, but I think again we just have to cycle back to where our biggest pullers, what should be pulling, and making sure we're using that. So in a pull-up, it's your lats. They're huge. We have a teres major back there. That's a huge puller, especially your mini lat. And all your scapular retractors are so big that kind of your little bicep should be the last guy on the chain to initiate that pull. It's still a huge helper, but it really should be kind of the last thing down the line. And I think that connection to your lats, knowing how to use your lats, working through the eccentrics, the hangs, the holds, everything like that. And he did all that. I've seen his pull-ups. They look really good. So from here on out, it's when he gets tired
Sure.
that he knows that he knows where those pulls come from, that form stays good. And we also talked a lot about that form that we also often see breakdown, where the front of the shoulders start to come forward, and that's when you know your biceps are doing way more work, because they're going to pull your shoulder forward into that bar versus your scapular retractors pulling you back and the external rotators keeping you in a really safe position. That's probably ultimately because that bicep tendon is then on tension and pulling at the same time, the riskiest position that someone like this could be in again.
Yeah. So I think going back to some of our foundations of building some strength with strict pull-ups would be important for someone like this. And while you're doing those strict pull-ups, as you said, Maddie, paying attention to what you're using. But after you do that workout where you've done strict pull-ups, where are you sore? I think sometimes that's a lot easier for normal people who aren't PTs to figure out what muscles have I used. So if you start with a low volume of strict pull-ups and you're worried about, did I do that right? How was my form? Take a second to assess 1 or 2 days later, where are you sore? If you're sore in your biceps and your forearms, then you did not do your pull-ups correctly. You should be real sore underneath of your shoulder, into your armpits, into those lats, into your rotator cuff, and not really anywhere else.
That's kind of my favorite thing to hear, is when a client runs back in after practicing those things. They're like, I did it and I was sore in the right places. And they're happy, I'm happy. And
that moment of, I didn't even know I had a muscle there. I've never felt that before.
Yep.
Okay. So our last question is, what exercises can I do at home to prepare to do pull-ups on the rig again? And I think this was the point of doing this episode, is so that we can give you some concrete things to work on. So we'll be releasing videos of some of our favorite ones, but I think just kind of we'll summarize going down the line of what we had talked about today. And that was generating some good lat mobility. So laying on your back, taking a dowel rod or even the bar over your head, and maintaining that good core stability, showing that you have good mobility in your lat. Doing some basic lat pull downs, making sure you're pulling with the right muscle with that lat, keeping that shoulder in a nice open position. Working through some rotator cuff mobility into external rotation. So can you open up into that full external rotation at 90-90? And can you do that with some loaded resistance back past your head, past neutral, and then over your head? Can you actively hang from the bar? Can you actively engage into all of those positions needed for kipping? And do you have at least 3 to 5 strict pull-ups? Anything else you want to add to that, Maddie?
No, I think that was the perfect list, and we will be definitely creating some videos that show you guys how to do that, talk through some of the things that we see that makes when you're doing them at home, you can make sure you're using the right things, and just really nailing down some of this form and accessory work so that when you get back to the gym, you're ready to go.
Yeah, I am excited. All right. Well, thanks for joining me, Maddie. I don't know what our next topic will be. We haven't decided yet, so maybe we'll put it out to the social medias and people can decide for us.
I think that sounds like a great idea, but otherwise I'm sure we can always find something to talk about.
We will. All right. Thanks, Maddie.
Thanks.
This Podcast represents the opinions of Dr. Mandy Vanderhard, Dr. Martha Betts, and the guests to the show. The content should not be taken as medical advice. The content is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions. While we make every effort to ensure information we are sharing is accurate, we welcome any comments, suggestions, or correction of errors. Privacy is of utmost importance to us. All people, places, and scenarios mentioned in the podcast have been changed to protect patient confidentiality. This website or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care in a legal sense or a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or website. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship. This podcast is owned by Affiliate Physical Therapy, LLC.